Hello, my name is Pat Bose and I'm the Executive Director of SCAN. And today we have with us a wonderful guest. We have with us Dr. Stephen Landers, who is the President and CEO of VNA Health Group. And we have lots of things to discuss with him. So welcome.
Thanks, so happy to be here.
Nice to have you. So I'm just so pleased to meet you because we've been trying to do this for a while. But tell us a little bit about how you come to our table today, your background, and you've been here for 3 years already. That must have gone really fast.
Yeah, it's gone fast, and it's a wonderful place to live. I love New Jersey. Originally from Cleveland, Ohio, and so a bit of an adventure moving the family east, but it's been all good. I really can't say enough positive things about New Jersey and the area, and really thankful to get to be a part of Visiting Nurse Association, because the type of work that we do are the things that really I've been passionate about my whole career, and so it's really been a dream come true for me to be able to be here.
So tell us a little bit about your career, because you were a little revolutionary way back when.
Well, I'm a family doctor, a geriatric medicine doc, and got involved in doing home visits mostly for older people that were struggling to get out to get regular medical care. And so really had an opportunity right when I finished my training, my medical training back in Cleveland, and got to start seeing people in their home and fell in love with it, and really started to learn what the needs are in the community. Also, all the great work being done by home and community health workers, and kind of came to think, wow, we're not appreciating the type of work that home and community health workers are doing. Nurses, physical therapists, social workers, personal care workers, aides, all sorts of caregivers that are out there, and really sort of took it upon myself to try and find ways to connect the work they're doing to the work of the doctors and the hospitals and the medical system, because really helping people age successfully, particularly when there's difficult issues, chronic illness, other things, it's a team sport. We all need to be working together inside the hospital and medical offices, out in the home and community. And so getting to work with the Visiting Nurse Association was a pretty natural thing for me.
I was going to say that's a really good fit, especially from where you came from. So tell us a little bit about Visiting Neighbors Association, and where is it at? Where are you projecting it to go, and how can we help you get there?
Sure. Well, Visiting Nurse Association Health Group, we're a 100-year-old community service organization, and we have programs and services throughout the state of New Jersey. And so we have almost 2,000 employees in our programs helping people at home in the community. Elder care is a major focus of ours. We do lots of home health nursing and hospice care at home, a lot of times helping people come home from the hospital when they need extra help, rehabilitation, medical treatment still ongoing at home. We also do a lot with young families. We have a number of programs that support moms and babies in that fragile period around pregnancy and the infant period. We work with a number of people that are struggling with certain health problems, chronic illness, everything from diabetes and high blood pressure, cancer, and HIV/AIDS. So it's a really diverse organization. The thing that ties everything together is that we help people in the home and community setting. We don't have a lot of buildings or offices. We're out on the roads and communities of New Jersey every day trying to help people at home.
So besides Monmouth County, what other counties are you in?
We're in Ocean County through our new partnership with Barnabas Health. Okay. We're in Middlesex County, Somerset County, Union, Hudson, Essex, Bergen, Mercer, Burlington, Gloucester. Wow. So we've got programming throughout the state.
So I should have asked you what counties were you not in.
Yeah.
But that's great. And again, I know that you work really closely and with all of the other providers of healthcare in those communities and with the offices on aging. And SCAN is really pleased to be working with your local staff to bring this good information and screenings and other tools to the local community. So again, before we finish, I want to thank you now. Yeah. Tell us a little more in regards to issues, or I think sometimes we get confused in regards to hospice and palliative care, and maybe you can clarify that?
Sure. you know, hospice care is a type of palliative care where there's a team of nurses and other caregivers, social workers, even chaplains that can work with people that have serious life-limiting illness, you know, succeed in the home, be sure they're comfortable, independent, there's support for their family. It's really a wonderful type of care if you know, you have one of those serious conditions where that's the type of thing that'll help. Palliative care is a broader term for other types of supports for people with serious chronic illness, maybe that don't have quite as poor prognosis as hospice. Hospice, at least the payment of hospice from the insurers, is limited to people whose life expectancy is 6 months or less.
Okay.
Whereas palliative care is not necessarily as restricted. Now, the ways that it's paid for aren't as clear either, and so it's not available in every community in the same way. But that's changing. The healthcare organizations are trying to figure out how do we provide great palliative care, and that can be relevant for people with serious illness, irrespective of what their prognosis may be. That's really a holistic focus on comfort, on dignity, on making sure their goals are met, on supporting their families. These are important things. You know, as a doctor, you know, we want to cure people. We want to try and solve the problem, but there's a lot of things that can't be solved. And, you know, father time usually wins in some way, shape, or form also. And so we want to make sure that when those situations are there, that we help people, that we have ways to make sure that they suffer less, that they get to live life to its fullest. And so, you know, I view hospice and palliative care really, not really about dying, quite frankly, but how do we make sure that people get to live the best they can with the time they have.
And again, I think that was just so clear, because sometimes when we talk about those two topics or two situations, it becomes just cloudy. So thank you, that was wonderful. I know that we talked off camera in regards to some of your initiatives, so maybe you would like to share some of that going forward?
Sure. Well, you know, as I mentioned up front, one of the main things that we're working on as a visiting nurse organization, home care and hospice, is having strong partnerships with hospitals and health systems. And we're very proud to work closely with the leading hospitals in the state to make sure that this care, as people transition out of hospitals or out of the doctor's office, is done in a coordinated way, that we have shared electronic information systems when possible, that we have care paths and teaching protocols that match up as best as possible. We want that experience to be a lot better, and that's what the regulators, the overseers of healthcare are expecting. But it's also the right thing to do for patients and families. So whether it's our close collaboration with you know, Central State Medical Center or the Barnabas Health System or Robert Wood Johnson University Hospitals or Englewood Hospital, these partnerships are driving a lot of our work, and we're trying much more to do that work in concert. We also are very excited about our new work with visiting physician services. We have a team of 30 physicians, nurse practitioners that are doing home visitation, sort of like, you know, Marcus Welby, but they're coming, you know, with laptops also and modern technology, and they can get blood work and x-rays in the home. So it has that old-fashioned humanism and compassion about it, but it's modern medicine, and that's really an important thing for families who can't, and people that aren't going to be able to get back to the doctor's office regularly because, you know, maybe they've had a stroke, or they have Alzheimer's disease or Parkinson's disease, or some other reason it's going to be hard to get out of the home to get care, but they still want to live at home and they want to be in the community. And in between our visits, you know, they have family and other community supports helping them stay there. Not everybody, you know, has to be in a facility when things go bad. And with the medical care, with the nursing care, with hospice supports in some instances, we can help almost anybody stay home. And that's a really exciting thing and something that we work really hard at.
And with that whole concept, it really is going directly to the conversations that we've been having for the last 3 to 5 years with you know, Medicare and all of the MCOs, managed care organizations, about how to keep people healthy and in their homes, because that's where they want to be. So it's sounding like you have that really well covered, and that's really exciting, especially the relationships and people knowing about, you know, your services, and that you're 100 years old. So you're not the new kid on the block. You've been around for a while. But again, I think that some of the messages are new and fresh, and so the direction, because that's where healthcare is going. So kudos.
Thank you.
So the other kinds of things that we'd like to know more about is, I know that you are an advocate on Capitol Hill and you speak on this topic a lot. What challenges do you see there or face there?
Well, that's quite a question. I mean, we've got a lot of challenges with our public programs, with Medicare, Medicaid, and how those are organized and delivered. I think that a lot, older Americans and people living with disabilities depend on Medicare and Medicaid for a range of things. And I would say that one of the things that's happening in a positive sense in recent years is that the folks that are running Medicare are seeing the need to help more people succeed at home in the community. The history really originally was as more or less a hospital benefit, as a sickness benefit, as something that was really focused on, doctors and hospitals when things got out of hand. And we know that a lot of people are living with chronic illness and ongoing problems and challenges. And if we just wait for those things to kind of bubble up, people unnecessarily end up in the emergency room and hospitals. And not only is that bad for them, because nobody wants to have to leave their home or the community unnecessarily, but it's also expensive.
Right.
So what my work has been around is focusing on how can we make sure that home care is a solution, that hospice care is a solution, that in-home primary medical care, home visitation can be a solution to those challenges that Medicare is facing. How can we make sure that more older Americans get the support they need at home and in the community, so that they don't need to unnecessarily be in the hospital? And for that, there do need to be some changes in Medicare. Again, it has been very much oriented towards sick care and hospital care. But I think that people on both sides of the aisle do get this. A lot of people have had family experiences and personal experiences with aging and with some of the difficult maladies that sometimes come along with aging, unfortunately. And I think that there are some serious discussions happening, but we need more.
Yeah.
With 70 million aging baby boomers, this is our country's Sputnik moment for elder care. And we really need to respond with pretty aggressive planning and rethinking how we do things.
So I know one of the statistics is that every day 10,000 people turn 65. So that's a little scary. Positively scary, because the alternative is not something that we would be wanting to consider. But in the same token, the information in regards to what they are entitled to, or what benefits, or how to even work the system, I think the whole education piece is so huge. And advocating, because there's assumptions that people just get it because it's been around for so long, but they don't.
Yeah.
They really don't. The other piece that I wanted to talk a little bit about is telehealth. I know that I'm not sure how much it's being used here locally, but I do know that it is, again, a new conduit for us to do better healthcare.
Sure, absolutely. I mean, there's been an explosion in mobile and digital technology in all aspects of our lives, right? I mean, I've got 3 little boys, and they know how to use these devices, and not just play games, but text message and use videos and things. And this technology, I think, is not just something that's going to be for the younger generation, but also to help make sure that older people and people maybe that are more isolated have access to important resources, social supports. In some instances, we might be able to help people through video conferencing at home. In our organization, we've done our first video visiting nurse visits in the 100-year history of the organization.
Wow.
We're not doing this to replace the humanism and direct compassion of somebody coming in your home, but maybe sometimes in between our visits or in an urgency, that type of technology is going to make us more facile in responding to problems, make people feel more tended to, not less. So we're really looking at telehealth as a way not to replace caring or humanism, but to actually elevate it, because there's only so many times somebody can come out to the home, and in between those visits, we want to support people as best we can.
So I'm excited to hear that, because SCAN is on the cutting edge, like you have said, that we are now working with small groups of seniors, and we're providing them with tablets, and they're becoming incredibly proficient in regards to email and looking up in apps. And so maybe at some point we can use them as part of your education process so that there can be this two-way communication. That'd be fabulous.
Absolutely, and it would be great to learn from you and their experience on what seems to work and what seems to help. This is by no means a solved question of how we use these tools to improve people's lives, but it certainly looks like it's going to be with us for a while. So let's work on it and figure out the best ways to make an impact.
Yeah, the first time that we met with them, which was almost a year ago, they looked at us as if we had 2,000 heads with this little tablet, and now they're so proficient that they just email. They don't want to write anything. So we'll get there.
Yeah, it's popular stuff.
It is.
It's taken off with everybody that's tried it.
And so I think their biggest challenge right now is how many gigs do they really need? The other question as far as community service. I mean, I know that you have, these 2,000 employees, and what do they do in the community, and what services do they provide?
Sure. Well, our employees are nurses, physicians, physical therapists, occupational therapists, social workers, home health aides. I'm sure I'm missing some. It is a really robust and diverse team. They work in community sites and also in the home setting, helping people live healthier lives, deal with difficult health challenges. And so it's really important work. Also, volunteers play an important role in our organization. In hospice care, the role of volunteers is especially robust. They make check-in phone calls, sometimes do home visits. We have volunteers that help with some of those early childhood programs, working with some vulnerable families, making sure that they have the resources they need, just the basics sometimes, food, clothing. We have a wonderful volunteer-run thrift shop in Manasquan. If anybody's ever in that area, the volunteers that run that program, I think, are as effective as any major department store in the country.
I'm sure.
They put their heart and minds in it and raise money to support some of the programs that don't have another payment source. So lots of work for volunteers, and also a whole range of community workers, business people every day to make this happen.
Yeah, and I know running an organization, whether it's huge or small, is just challenging. So I can feel for you as an executive director, as the president and CEO of this huge corporation business, not-for-profit, that you have a lot of balls up in the air to make it all work. And so sometimes we don't, say thank you enough. So I would like to say thank you on behalf of SCAN in regards to all of the wonderful collaborations that we've been able to do with VNA and with all of the employees that we've been exposed to, and we're hoping that that will continue. And so if we have a couple more minutes, so if there's any additional things that you would like to put on the table, just tell us about. How does one get in touch with you, your organization, if they're interested in volunteering or your services? Well,
thank you for your kind words, and I'm thankful every day to get to do this. It's an honor and a privilege, and it really is something to behold, and to just get the feedback from the community about the great work that Visiting Nurse Association is doing for people is just really heartwarming and exciting. I really encourage particularly older people and their families, particularly when you're healthy and on a good day, to think about how you might want to handle things if things got difficult, either an illness or some type of difficulty. We don't want to think about it, but unfortunately, if we don't plan ahead, we might not be prepared when the time comes. And I know, and my colleagues know, that when people plan, when they think about what are they going to need to do to be able to stay in their home as long as possible, what resources they're going to need, that it goes a lot better than when they have to make all those decisions on a tough day and on a bad day. And so I really encourage people to think about that, to plan. We're Visiting Nurse Association Health Group, VNAHG.org. And we're here both in our main office and throughout the state to try and help. So please reach out anytime. It's really wonderful to get that outreach, and anytime we have a chance to try and work with somebody in the community, we're excited about it.
So again, thank you very much. And we'll be taking a short break, but I would like to again thank Dr. Landers for being with us and informing us and keeping us up on what's going on in this fabulous organization. So talk to you soon.
Pat, thanks so much.
Take it from me. Living with a chronic disease is no easy task, but I learned to better manage my health condition, and you can too. Take Control of Your Health is the chronic disease self-management program created by Stanford University. This fun, innovative course is now offered to all county residents. Diabetes, arthritis, heart disease, cancer. Take Control of Your Health gives proven strategies to manage these conditions and reclaim your life. See how nutrition, exercise, and various mind techniques can help you overcome depression, increase energy, and manage pain. You'll not only get this book when you participate, you'll also receive the guidance and support of others living with a chronic illness, just like you. Take control of your health in 6 short sessions.
Call the number on your screen to register or get further information at scannj.com. Brought to you by SCAN, Social Community Activities Network, with funding made available by the Monmouth County Office on Aging.
SCAN, the Social Community Activities Network, has been serving the active adult community since 1988. Our main campus is conveniently located in the basement level of the Monmouth Mall, near the mall management offices. SCAN's affordable classes include physical fitness, computers, digital photography, Spanish, Italian, literature, art, music, TV production, and more. Also, Medicare resources and programs such as Take Control of Your Health, Financial Literacy for Older Women, and Brain Fitness. SCAN will be featuring trips and lunch and learn programs geared to complement your lifestyle. Visit our website, www.scannj.com, or call us at 732-542-1326, or visit us.
Welcome back. My name is Pat Bose, and I'm the Executive Director of SCAN, which stands for Social Community Activities Network, and we're located in the Monmouth Mall. And with me now is a new member to the SCAN family, Mike Brady, and I will tell you how he comes to us in a little bit. But I do want to take this opportunity to let you know what's happening here at SCAN. We presently will be having 4 divisions after a retreat with the Board of Directors and approval. SCAN has, I guess, found its way, if we would want to say that, because we've been doing a lot of new and exciting things both here at SCAN and in the community. And so we really wanted to pay more attention and concentrate on the 4 divisions going forward. And so the first division would be the hub, and that's what we're calling our location or our campus at the Monmouth Mall. And this is where all of the action takes place, and all of our volunteers come and our members take classes, and we provide other opportunities for people to stay engaged. The second division is called Scan on Wheels, and this is brand new, so we're really excited. After last year, we were doing a pilot project. We were one of 7 nationwide that had been picked to work with seniors who had low or no technology background, limited incomes, and make them proficient in using tablets. Each of our 25 members of that group received tablets, internet service, coaches, and weekly meetings. So I must tell you, they now Skype, they have emails, and they do Facebook more than I do. So that's really exciting. And as a result of that, we decided that we should be taking SCAN on the road. So we're going to be visiting or establishing relationships in 2 or 3 other communities throughout Monmouth County that are underserved in 2016, and bringing all of our information, our community partners, including the VNA, Monmouth Medical Center, Interfaith Neighbors, Family and Children's Services, and a few others, to the senior in the community. We'll be there for 10 to 16 weeks, and then we will move on to another underserved community. We hope to be the conduit of really good information and resources to those who can't get to them. So that's exciting. Our third division, and probably not to 2017, is that we want to do some pre-retirement workshops in the workplace. What we find here is that so many times people who retire and didn't plan to retire or plan for retirement other than their financial situation come here and they're bored to death and they are isolated and sometimes depressed. And we know that if that's the situation, that they might get sick or ill quicker. And so we're really committed to keeping everyone as healthy as possible and having fun while they're at it. And the fourth division is technology. We know that there has to be a lot of platforms for us to deliver good content and information to you, our members and our potential members and the community. So besides doing these wonderful shows that we bring to you every month on Comcast, Cablevision, and Fios, we will hopefully be doing a radio show that will be have exposure both in Monmouth and Ocean County, and also we will be upgrading social media. Much to my chagrin, but I am absolutely committed to, if you use Twitter or if you use Facebook or LinkedIn, you'll know about us and how to get in touch with us. So I'm really excited about that. But my biggest accomplishment is that we have just officially started an adult internship program. And that's how Mike has come to us. So welcome. So tell us a little bit about you.
Well, let's see, I spent 38 years working as a civilian for the Army and the Navy, which was a great honor and a privilege. And then I retired. I was retired for about a year and a half, got very proficient at riding my bike and kayaking. And now I'm just real happy to be here with SCAN, shaking out the cobwebs, scratching off some of the rust, and getting back proficient on the computer and stuff, which, as you just said, and I'm just real happy to be here.
Well, that's great. And so what you're going to be doing with us, you'll be with us at least 10 hours a week, and you will be helping us do our marketing. So you're going to be coming under that fourth division in regards to getting the word out and good content, because that's one thing that we don't have available is, while we do all of these wonderful kinds of programs like Brain Health Fair and hopefully a senior expo next year, that we don't get it out to the public timely and they don't know what to do or where to go. So that will be your role, helping with the newsletter, writing some creative, wonderful letters, hopefully going forward, so that we can generate more membership, because that's what keeps us going. And we're really happy to have you with us. And so we're looking for additional interns, and skill sets that we're looking for is that we are looking for a coordinator for the hub here, and we're also looking for people who can help us in regards to teaching some classes and promoting us in the community. So if anyone out there is interested, please make sure that you get in touch with me at SCAN at 732-542-1326. And we'd be more than happy to invite you into the family. The only other comment is that winter session starts on January 11th, and we have 13 wonderful weeks of excitement. So thank you very much. If it's important to you, it's important to us. So hopefully we'll see you soon.
How to locate SCAN. SCAN is easy to locate once you find the movie theater at Monmouth Mall. As you enter the parking lot from Route 35, the theater is almost directly ahead of you. Drive towards the theater, but go up along the left side into the parking lot. As you approach the end, you will see entrance number 3 on your right. Park and enter the building here. Once inside, you will see a staircase that only goes down. After passing through the doors at the bottom, turn to your left, and SCAN is right there.